Catherine Konashevsky. I'm a speech-language pathologist, and today I'm going to be speaking about changes in communication following a brain injury. There is a lot under the speech-language pathology scope of practice. We cover receptive and expressive language, cognition, swallowing, and speech. Today I'll be specifically talking about communication. Communication can be broken into two different realms, one of which is language. Language refers to the words that we use and how we put them together to create meaning. The term for difficulty with language after a brain injury is aphasia. The other realm of communication that we'll speak about today is speech, and that refers to how we produce different sounds. There are a couple different ways speech can be affected by a brain injury, one of which is called Dysarthria, which involves the muscles that move to make speech. There's also apraxia of speech, which refers to difficulty coordinating mouth movements that together make words. When an injury occurs on the left side of the brain in the temporal lobe, there may be difficulties with speech and language. Language can be considered in two different ways. Receptive language is essentially understanding what other people are saying to you, and your ability to understand spoken language and written language. Expressive language is essentially your expression and how you speak and write. Receptive communication challenges may look a couple different ways. People may have difficulty paying attention to what is said or misinterpreting what somebody else has said. Receptive language can also affect how people understand body language or symbols, and then it can also affect reading comprehension or how people understand written language. Expressive communication challenges can manifest a couple different ways. People can have difficulty stating the main idea or the main point. People will often have trouble finding the right word to describe what they're trying to say, almost like that tip of the tongue sensation where you know what you want to say, but it's not coming out. So some people may have trouble getting any words out at all. And then another side of aphasia is called fluent aphasia, where people have no problem getting the words out, but the words don't necessarily make sense, and they may sound jumbled or confused, or some people use the term word salad to describe that fluent aphasia. Somebody may also have difficulty initiating conversations or maybe slow to respond in communication. And then people may also have some difficulty expressing themselves with gesture or body language, and it may not match up with what they're saying. There's also different social communication challenges. People can become off topic or kind of monopolize the conversation and not realizing that the other conversation partner hasn't had a turn. People may become perseverative or bring up the same topic over and over again very repetitively. And then some body language can also be affected. People may stand too close or too far, not make eye contact, or make too much eye contact. Moving on to speech, dysarthria refers to weakness of the muscles in the face that are responsible for speech. So someone's jaw, lips, or tongue may be affected by their brain injury, and in turn it affects how the sounds come out when they speak. Dysarthric speech can sound slurred or slushy or thick. Some people may sound drunk when they have dysarthria. Apraxia refers to difficulty coordinating the mouth movements that you need for speech. If you think about how many times your mouth and lips and tongue are moving when you're speaking, you'll realize how complex it is to coordinate all of those movements. So apraxic speech may have the sounds correctly and precise, but they may sound jumbled. A hallmark of apraxia is that each time somebody tries to say a word, it may come out differently because the coordination is what's affected. So an example might be if someone's trying to say buttercup, it might come out tutterbup. All the sounds are just a little bit mixed up. Both of these conditions exist on a spectrum, so it could affect some sounds or some words, but not others. And then on the more severe end of the spectrum, speech may not be intelligible to others. So regardless of the communication that's affected, early treatment is critical to the recovery of your speech and language. Your speech therapist will help you understand what's happening with your communication and the best way to help. Speech therapy may involve a couple of different things, including exercises or stimulation to help the muscles in your face. It may also include learning different strategies to help your speech sound clearer. For aphasia, there are different strategies to help find words that are stuck, There are drills and practice to help with comprehension or understanding of spoken and written language. There are also different protocols that help practice retrieving words, building sentences and conversations. The speech therapist can also cue people on different ways to move their lips and tongues and help coordinate the movement in the right way. So there are lots of things that you can do to help a loved one with a communication impairment. The first is remembering that just because a person's communication is affected, it doesn't mean that who they are or their intelligence is affected. Having a communication impairment can be incredibly frustrating because essentially you know what you want to say, but that connection with another person is severed with the communication difficulty. Some people tend to want to speak louder or slower, but speaking with a normal tone of voice and using simple but not childlike language is very helpful. Asking yes or no questions can be very helpful to confirm understanding if you're not sure if the person you're speaking with is receiving your message. An example of that would be, instead of asking, "What would you like for dinner?" you could ask, "Would you like chicken? Yes, no. Would you like pasta?" That kind of thing. You can also modify your environment to be supportive of a person's communication ability, including trying to have conversations in quiet one-on-one settings and eliminating background noise as much as possible. Especially with aphasia, multiple speakers or lots of background noise can be a very difficult situation. It's also very helpful to acknowledge communication difficulties and breakdowns and try and fix them. A supportive communication partner will let the person they're communicating with know that you're going to work as hard as you can to understand what they're saying and be patient with them. For some people, writing down key words, pictures, or using gestures can help. Everyone will have different strengths and weaknesses, and their speech therapist will definitely help you identify those and determine the best way for you to communicate with somebody. Engaging in normal activities as much as possible is very, very helpful. So trying to partake in things that people enjoy and normal social situations as much as possible is very helpful. Aphasia can be incredibly isolating, but if you can support life participation as much as you can, it will help the person with communication difficulties feel less isolated, and it will also help support their communication skills. Thank you so much for watching this video, and we hope you continue to watch the rest of the videos on the Brain Injury Education series.